time now for a look at your health, and we are heading into the time of year when you want to show more skin, but for people who suffer from chronic skin conditions, it can be frustrating, especially if you have something called rosacea, which occurs right on the face. UCSD's Dr. Mitchel Goldman is here now to explain what it is and how you can treat it. Thank you for being here.
Good to be here.
So this is something we want to catch early, so it's important to know the signs of it. Explain what those 7 signs are that you might have rosacea.
Well, one of the key signs is persistent flushing. So it's not just where you flush or blush and it goes away in a few minutes. It's where the redness actually stays for hours and hours. And what ends up happening in rosacea is when that redness stays, what does the redness mean? It means that the skin has increased blood flow. So your blood vessels actually dilate. The other types of signs that can happen in these patients, the blood can actually dilate, your cheeks can get rosy, and it can actually turn acneiform, or you can actually get acne-like lesions.
And who would suspect that's rosacea? You would think, oh my gosh, I have acne.
You would, but the difference is rosacea usually occurs in teenage years but becomes really worse in the adult years. And so the longer you have rosacea, the more your skin thickens, the more acne lesions come, the more blood vessels come, and finally the end stage of rosacea is when you have that W.C. Fields nose, that really big nose, which is a dilatation or growth of all of the oil glands.
That's really interesting. So if you suspect that you have it, what is the next thing that you should do?
Well, one of the most important things of everything that we talk about on Tuesdays is prevention and try to minimize the effects. So there are triggers that can cause rosacea. The triggers are alcohol, caffeinated beverages, hot and spicy foods, heat, and sun.
Really?
Yes, and so you basically, when you're in the sun, wear sunscreen, try to avoid those trigger factors, which are the foods. But as for a treatment, there's a wide variety of skincare products that I brought as well. And then what we're seeing on the air now is a laser treatment. This is called intense pulse light, and the intense pulse light is actually going to get rid of all of those dilated blood vessels, and what that does is it calms a problem down, and the results last for years. Not only do you get rid of all the blood vessels, but the skin takes on a much healthier complexion.
So is that is an option for more severe cases, and this is more prevention, or is this just topicals that you can use if you have this chronic rosacea?
Well, it's like yes or no. If you have a condition, you want to try to do things to minimize it, and that's by using topical medications. The treatment that we do with the laser, actually we do it fairly young. I have a patient now who's an actress on TV, and she flushes, and the flushing can be very distracting, especially when she's on camera with all those high-definition close-ups. And so we treat her intermittently with the intense pulse light that keeps the rosacea under control and allows her to not be so self-conscious being on camera.
Tell me about some of the products that you brought here.
Well, there are many different products on the market. I've picked 3 different types: the Aven, the Neocutis, and the Skinmedica. They each have ingredients in them that calm the skin down, and these are botanicals. There are newer topicals that are coming out that are prescription that will be available in the fall that actually have ingredients that seal the blood vessels closed so that they don't dilate. And finally, some people with rosacea will take a long-acting doxycycline pill, so it's a prescription pill, and that, again, decreases a lot of the infectious components that occur with rosacea.
And I'm assuming this is a problem in people who are fair-skinned, not people of color?
It is. It's usually Scotch-Irish. Although it's interesting with the mixture of many of our races, because African Americans can have a little bit of Scotch-Irish in them too and not even know it, they can actually get rosacea. But usually almost everyone with rosacea has some ancestry in the Scotch and Irish republics.
Those darn Irish, I tell you what. All right, well, thank you so much, Dr. G. Always good to see you.
Good to be here,
every
Kathleen.
Tuesday, and we have an appointment with him again next Tuesday, Walter.
All right, so good information. Thanks.